Now, every day we learn just a little bit more about COVID-19 and who is considered high risk and what steps we can take right now to protect ourselves and slow the spread of infection to others.
Absolutely. Dr. Kathleen Nash, she's a chiropractic physician with Total Transformation, and she's here to kind of give us the information we need so we can help mitigate our risk. It's great having you. How are you?
I'm good. I'm safe in my home. Hopefully, I can see you guys are doing the same thing, and I hope everybody watching is doing the same thing.
Yes, I'm comfy in my socks. We're all doing all right over here. Well, let's talk about this. Obviously, we when the first words were coming out about COVID-19, it's like, it's old people. And then it's all right, it's old people. And if you have immunocompromised people that may have fought cancer or fighting cancer or maybe pregnant. But then we're starting to realize that it might not just be that. It might be if you have extra pounds on as well.
Yeah, we are starting to see some serious concerns regarding the immunocompromised. So, just like you said, it's very clear based on the data that's coming out that the people that are most at risk for developing significant or life-threatening conditions as a result of the virus are the elderly and the immune compromised. But what people don't know is that it means that 52% of adult Americans are technically at higher risk for contracting the virus,
Wow.
developing significant or threatening symptoms, and developing complications from it. So more than half of US adults are potentially considered high risk.
Wow.
And let's
Yeah.
talk about that 52%. What kind of conditions make up that percentage?
Yeah. So the reason we say 52% is because the immunocompromised conditions that are on the high risk chart are directly related to dietary hormone damage or insulin. So we know fatty liver
Mm.
is high risk. We know heart conditions are high risk. We know type 2 diabetes are high risk. These are all traced back to insulin resistance. So heart disease, diabetes, high blood pressure, and cardiorespiratory issues. In the medical community, we actually call this metabolic syndrome, and it's currently projected that 124 million American adults have the condition. So it's not that the COVID-19 virus targets obese people, but it's that an overwhelmingly large percentage of the overweight or obese community have the condition.
I see.
So, for example, 87% of type 2 diabetics are overweight or obese. So, what you would really want to do, one of the best things we can do now that we are confined and we have a bit of time on our hands, is doing whatever we can to improve our current health situation and boost our immune system through nutrition.
Yeah, this is a good time to work on
Yeah.
ourselves. So let's talk about that. You say there's 5 things we can do when we're stuck at home to help improve our situation. What are those things?
Well, there's three big categories of what we can do. The first one is practicing the five, and that is an absolute must in order for you to minimize your exposure. So that's things like washing your hands frequently, disinfecting surface areas often.
Yeah.
When you cough or sneeze, you're going to do it in your elbow. You're going to stay away from people and you're going to stay at home if possible, right? The second big category is the proper hygiene, washing your hands for at least 20 seconds, disinfecting those common areas. If you suspect that you've been infected, sleeping in an isolated space. And then the third one is giving your body as much quality nutrition in your diet as possible. So the losing weight part that I normally talk about, that's a long-term strategy, but you can start working on it right now when we have more time.
Yeah.
But changing the foods currently in your diet and including heavy doses of nutrition is probably one of the fastest things you can do immediately to help bring up a depressed or a compromised immune system.
Yeah, and let's talk about some of those foods that you recommend. I mean, right now in my house, we've run out of bananas, which is kind of like a personal tragedy for me. I know Sean and I have been talking every
Yeah.
day about what we're eating. We're all very aware of our health right now. If our food choices are limited, or if, say, we're putting off going to the grocery store for a week or two, how do we make healthy food choices with limited food in our pantries?
Right. So that's something that we're also seeing quite a lot of. In the beginning, we saw a lot of the snack foods and processed foods were the main things that we were running out of. But as supplies get low, even the healthier foods, it's still taking time for food manufacturers to bring up the demand. So
Yeah.
what I've done is I've worked with the developer of my liquid nutraceuticals to provide an immunodefense formula that has specific ingredients to help boost the body's natural immune defense. It also inhibits replication of strains of influenza virus in infected hosts, and it helps
Mm.
treat the complaints of respiratory illness. So my developer only works with healthcare professionals. This way, we're allowed to provide a higher grade potent liquid extraction of the nutrition because unfortunately, when you are immune compromised, your ability to absorb nutrition is also compromised. So to try to help as many people as possible during the pandemic, I'm now offering that specific liquid nutraceutical to the general public in a 30-day supply so that they can incorporate physician-level nutrition in their existing diet. It is not a cure. No one can claim that they know how to cure the COVID-19 virus, but it is a potent dose of ingredients that the body needs to help defend itself and bring its immune system up.
No question. And the website on your screen, go.drnash.com/VIR. Really quickly, that special offer, let's talk about your special offer for those who are interested in total transformation down the line. Once we're able to walk back in, what are you offering up?
Right. So we're still doing the evaluations, but of course we have to do them online.
Yeah.
Right now, though, the biggest thing that we are pushing is trying to get the nutrition and changes to the diet to try to protect the immune system. The best way for people to do that, of course, because supplies are limited as a result of the need and the urgency for these kinds of materials, would be to go to the go.drnash.com/VIR. That's the quickest, fastest way for you to get the supplementation. If you are interested in doing an evaluation with me where we can fine-tune your program to get you the help that you need, you can call the office at the number that's on your screen.
Awesome. It's great having you,
Dr.
Dr.
Nash, thank you so much. Reach out to Dr. Nash. She's located in Henderson on Horizon Ridge Parkway. Her website, her phone number, right there on your screen. Total Transformation, proud sponsor of the Morning Blend.